What in the world is a stem cell? Well, folks, that's one of the most common questions I get in my office every day, or maybe we're out doing a workshop, and that's the question that always comes up. So let me answer it this way. I don't know if you knew this, but we all have stem cells running around through our bodies. You've heard of your immune system, you've heard of your cardiovascular system, you've heard of your musculoskeletal system. Well, maybe you haven't or aren't as familiar with your healing system, and that is the system of your stem cells. They are designed or were designed to heal and create and fix things that go wrong in your body. In fact, stem cells were around when we were very young. That's what built our bodies. The problem is as we age, our stem cell count goes down. All right, we're going to talk more about that in a separate video. But where do stem cells come from? Well, there's a couple of different places. What we are not talking about in this video are embryonic stem cells. That's where the lab or the doctor would go into mama's womb with the babies in there and draw out some stem cells. That in the early 2000s was a lot of controversy. It's unethical. We wouldn't do that if we were allowed to. That is not what I'm talking about here. Then there's another type of stem cells, autologous stem cells, where we use your own stem cells to create and fix things. The problem is, as I mentioned earlier, as we age, our stem cell effectiveness and our stem cell count goes down. It's called degeneration or aging over time. Maybe you've heard of PRP, and that's possibly where the lab or the doctor has pulled your stem cells from your bone marrow or possibly from your adipose tissue, where they drew blood and they spun it in a centrifuge, and we reach down in there with a needle and pull them out, and we stick them into a joint that needs some work. The problem is, research shows us that over the age of 35, our stem cell effectiveness and our stem cell count drops off a cliff. So if you've had PRP or used your own stem cells in the past and it didn't work, well, it's probably not that stem cells didn't work. We just used the wrong kind. We used your own, and you're just a little bit too old for that. Then there's another type of stem cells that are donated by someone else.
How are we doing, guys? Thank you for making it this far in the video. My name is Rebarcak, and I'm also in charge of the day-to-day operations, which means I see you guys leaving comments in our videos asking for help and asking for more information. I want you guys to call me or text me. My number is 480-709-0645. Call me or text me the word HOPE, and I will get you any information that you need. We do in-person seminars and online webinars at least once a week. If you're interested in attending any of these, they're completely free. Reach out to me and I will set you up. Thank you so much, and let's get back to the video.
We call those day zero stem cells. And those are stem cells that come from something called Wharton's jelly. So think of it this way. The umbilical cord is in mama's womb, right? The jelly is that the coating around or surrounding that umbilical cord, and inside of that jelly are what are called mesenchymal stem cells. Now that's a big mouthful, but those are the type of stem cells that just built this beautiful baby. It just built the baby's musculoskeletal system and nervous system. And I want you to think of this. When we use or when we harvest mesenchymal stem cells from Wharton's jelly, the baby's already out of the womb, probably in mama's arms, feeling great, and everybody's all joyful and happy, so there's no invasion on the baby. Those stem cells are much more effective. They do the job much more efficiently, and in number, they're a vast higher of a number. So that was a brief description of what stem cells are, and in a subsequent video, we're going to talk about exactly what they do. If there's anything that stuck out to you in this video and resonated with you, and you're like, boy, I could use more information, or I need that, or you want to maybe come to one of our webinars that we host every week, or we'll have dinner workshops all over the country. If any of that interests you and you want more information, just text or call the number 480-709-0645. Again, 480-709-0645. Just text the word HOPE, and then one of us will get right back to you.